Hi, today we're going to discuss the topic of abnormal uterine bleeding or AUB. AUB, or formerly called as dysfunctional uterine bleeding, is defined as any abnormal uterine bleeding with no identifiable cause. It is a diagnosis of exclusion, which means that we have to eliminate other causes of uterine bleeding such as pregnancy, medical issues, or identifiable pelvic problems. So the bleeding is actually unpredictable. So it could be excessively heavy, excessively light, prolonged, frequent, or it could also be just random. AUB is most common at extreme ages of reproductive years. So this includes adolescents, usually first 2 years of menstruation, and perimenopausal women, so the period of a woman's life shortly before the occurrence of the menopause. The classification of AUB is called palm coin. Palm is used when the cause is structural, which could be diagnosed and evaluated through imaging studies or biopsy, while coin is used when the cause is non-structural due to an underlying medical disturbances that cause the abnormal uterine bleeding.
PAM coin stands for specific terms, however, I'm only going to discuss the structural causes, polyp, adenomyosis, and leomyoma. Polyp is the most common, non-cancerous, new abnormal growth in the cervix. This is common in patients with multiple pregnancies, ages 40s and 50s, with 3 types which are endocervical, cervical, and endometrial. It varies in color depending on the site of the polyp. Many endocervical polyps are recognized for the first time during a routine speculum exam, while endometrial polyp may be discovered by vaginal ultrasound. Classic symptoms of endocervical polyp is bleeding between menses, while endometrial polyp is heavy and prolonged bleeding. Note that majority of polyps are asymptomatic. Adenomyosis is the abnormal growth of gland in the uterine lining. This disease is common with over 50% of women are asymptomatic or have a minor symptoms that do not annoy them enough to seek medical care. Classical symptoms include prolonged or heavy bleeding and painful menstruation, common in women ages 30s to 50s. The disease is associated with women with increased numbers of pregnancy. Ultrasound and MRI are both useful to differentiate adenomyosis and myoma. However, MRI is more specific. The best management includes the removal of the uterus. Leomyoma, or commonly called as myoma, is the most common non-cancerous abnormal growth in the uterus. Risk factors include increased age, early start of menstruation, low total number of pregnancy, tamoxifen use, obesity, and high-fat diet. The most common symptoms related to myomas are pressure from an enlarging pelvic mass, pain including painful menstruation, and abnormal uterine bleeding. The severity of symptoms is usually related to the number, location, and size of the myomas. However, over 2/3 of women with uterine myomas are asymptomatic. In general, urinary symptoms are more common than rectal symptoms, and menses were longer in duration and heavier. Clinically, the diagnosis of uterine myomas is usually confirmed by physical examination. CT and MRI can distinguish between benign and malignant myomas. For surgery, indications are persistent abnormal bleeding, pain or pressure, asymptomatic myoma of more than 8 cm. Contraindications are pregnancies, advanced adnexal diseases, malignancy, and the success of surgery depends on the age of the patient, size of the myoma, and the number of compounding factors.